Well, good morning and welcome back to my channel. It is again about 5:40 in the morning here in Phoenix, and hey, I just thought that I would give you guys an update. So again, welcome back to my channel. Yes, I am actually filming from my hospital bed. I am laying completely flat as I am not able to sit up yet, but throughout this journey, if anyone's been watching any of my previous videos, they know that what I thought to be another tendon tear in my foot actually has turned out to be low back problems and a severe bulging of either S4 or S5. I can't remember which one it is, but a disc in my back. And it was bulging so bad that it was putting so much pressure on my spinal cord. I've actually lost function in my lower body, and I have something called CUDA equitis. CUDA equitis, I think is what they call it, but not MS related at all. So I did have surgery yesterday. In about an hour and a half, I will be able to sit up, and because right now I am still on a drain. I am still on a, let's see, yeah, a drain, basically, because he wants to just make sure that the fluid comes out of my low back. My pain level immediately changed. The moment that I woke up, I could tell the difference, and I'm actually have feeling in my toes already. So I know that the relief is coming. I see results already, and I'm really looking forward to the recovery. It's going to be hard work. It's going to hurt really bad, but you know me, I'm definitely persistent, and I will get it done. I also follow doctor's instructions to a T. I do very good at that, and I found that especially with my ankle surgery, that when I did that, I had no setbacks in healing, no setbacks in recovery. Please forgive me, my mouth, from being intubated yesterday, they kind of pinched my lip. Anyway, so I've been able to keep some food down this morning, been eating Jello, and yeah, watching a little bit of TV, and then I go back to sleep a little bit. I didn't sleep at all yesterday, and but basically I'm doing really well. Here's the clincher. Here's the thing that I'm most proud of. I am not having any MS trouble at all. I believe that the Ocrevus is keeping me still stabilized, that I am not having any MS trouble. I did actually go see Dr. Hendon at the start of finding out that this was my low back, because after working with the podiatrist and the MRI showing nothing wrong in my ankle, he wanted me to go see the nerve doctor, whom is definitely Dr. Hendon, even though he specializes in MS. That's pretty much what he sees all the time, but he was very excited to be able to, quote, be a doctor again, as a end quote is what he said. So again, no MS trouble, and I truly believe that the Ocrevus is still the best medication ever. I will stay on it for as long as it is effective for me. And anyway, so that's just my update. Hopefully in, like I said, about a half an hour, I'm going to be able to sit up here soon. My back is worn and tired. I'm only 46 years old, and I do have degenerative disc disorder. I have had for several years, and I have maintained that with chiropractic because I truly believe in a non-invasive way. But look at me, here I am after severe back surgery. Dr. Abrams did it yesterday. He thought that it was only going to take about 3 hours. It did take about 4.5 because he was surprised at the amount of degeneration once he got in there. MRIs can only show so much. So what he ended up doing is doing a lot of cleaning up of the discs and the junk that was in my spinal cord, lower spinal disc area, and and so he was able to clean that up. So hopefully once this heals, I should be back to normal. I have full intentions of going back to work in 6 weeks, and I miss everybody, something horrible. Hunter has been by my side through the whole thing, taking care of me. I will be in a wheelchair for a little bit. I do have a new back brace, and I'm looking forward to that. My sister was here with me yesterday, and the moment that she walked in the door, I knew for sure that everything was going to be okay. Kylie came and spent some time. Colby stopped off and brought me flowers. Joey and Shelly came by, and little Anthony bought me a porcupine. It's actually not a porcupine, it is a hedgehog, but he is the most adorable thing. He's my porcupine. So I've actually decorated my room. Doctor is going to keep me here for probably a couple extra days, just because of the amount of debridement that he pretty much had to do. So we'll see. So they can keep my pain managed and everything. So I'm just looking forward to being able to feel when I have to go to the restroom again, or feel when I'm going to the restroom, because I have such severe numbness that it's just unnerving. So the pain level was immediately different the moment that I woke up from surgery, and the nerve pain was just almost gone. It's going to be interesting to see what happens today once I can sit up and that kind of stuff. I have been rolling over from side to side, but I do pretty much have to stay full on my back. I do have a drain. It is a compression drain, but we are not, doctor didn't want him to do any compression. They just want it to drain on its own. So I do have still a couple things that are attached to me, and hoping that we can get the drain out today as well, if not tomorrow, because I think he'll let me go home tomorrow or Monday. Yeah, I'm excited. So anyway, saying hello from my hospital room. I just wanted to give you guys an update. I know it's such a pretty, wonderful gown, and I look so wonderful right now. Just saying. But anyway, leave any questions, comments, any well wishes, or anything that you'd like to do. Please subscribe to my channel when you get a moment. Go ahead and hit that bell so that you notice when I upload a new video. And again, just leave any questions, comments, offer some good support. We have a lot of MS patients that are on here. Some are brand new, some are older like me. So just offer any support that you can. If you have questions, please ask them, because there's absolutely no reason why. Any dumb question is a question that is not asked. I know that is so cliched and something from the 60s, but it's still fact. It's still definitely fact. So anyway, I'll go ahead and sign off for now. I will do a couple updates, hopefully, about when I get to go home, and the status of this. One more thing, actually. Dr. Abrams does say that this degenerative disc disease, he does not believe is related to the steroid usage, even though he was extremely concerned about that. So once he gets here today, I will be able to ask several more questions, and I will be able to find out a little bit more about his thoughts on that. So that sometimes you know, you got to decide on what's the lesser of two evils, and I made several choices, and I don't regret them, at least not today. So anyway, I'll definitely talk to you guys soon. Again, leave any questions or comments, and I hope you guys stay healthy.